People who are nutritionally deficient in certain things can cause high blood pressure, like magnesium. Magnesium has a very important role in the body, and it plays a big role in lowering blood pressure. The other important thing that's often missing in diets is omega-3. Omega-3 fatty, or like fish oil, it helps your blood vessels relax. So it opens them up, right? Because stiffening means that it's high pressure. If you open them up, they can relax. They're more pliable. So omega-3 helps with that. And of course, this would not be a Dr. E episode if I didn't tell you that somehow in all of this, the gut microbiome is part of it. And of course it is. If the gut microbiome is altered because of our standard American diet, processed diet, medication, it can cause inflammation. And you already know that inflammation dries up high blood pressure. So if you are going to manage your blood pressure, you also need to manage your microbiome. Believe it or not, for a lot of people, gluten sensitivity can also be an issue for blood pressure. And I'm not just talking about celiacs. I'm talking about the whole world of what we call NCGS, non-celiac gluten sensitive. So sometimes just cutting out the processed food, taking out the dairy, starting some good quality supplements, and you suddenly start to see a quick decline in blood pressure within 10 days. Now, remember when I say gluten-free, I don't mean go outside and buy gluten-free Oreos. I mean good quality food, don't have gluten in it. I get really nervous when I say gluten-free because you could fill up your whole pantry with gluten-free nonsense. I don't mean that because that's still processed and it's still going to drive up your blood pressure. So I don't want you to come back and say, I eat everything gluten-free. I'm not really sure why it's so high. That's why. On this topic, I always want to talk about sodium because people ask me all the time, can I have salt in my food? Can I not have salt in my food? So let's kind of determine what we mean by sodium. Sodium, you see it on the ingredient list on food. It is very, very high in processed food. That's different than the salt that we add to our food with a salt shaker. If you're just adding salt to your food, whole food, it will not add up to the sodium in processed food, okay? I wanted to take a moment also to explain why exercise lowers blood pressure. People talk about, that you need to exercise, but why? Why does exercise lower blood pressure? In fact, in the moment, you might be feeling like it's high, right? You're super energized. How does it bring it down? 30 minutes of movement. I don't mean to go on a CrossFit max challenge. 30 minutes of movement. Everybody's movement looks different, right? Some people it's walking down the block. Some people it's going down the driveways. And then some people are, going to a max challenge or to a marathon. Wherever your movement is, 30 minutes of movement. The reason it works is because it improves the inside of the pipes, what we call the endothelial function. The inside of the pipe, there's a lining inside the pipes. And when we exercise, we're actually improving that lining because we increase a chemical called nitric oxide. And exercises helps you release more and more of this NO, which loosens up the pipe, heals the lining inside, and allows the blood to flow more freely. And that happens immediately. As soon as you work out, that happens. So you have an immediate relaxing of your vessels, opening up, a dilation, and a calming down and a reduction in blood pressure. So here's the bottom line. Blood pressure is dangerous. It can kill you. But before it kills you, it will cause a lot of damage to your heart, to your brain, to your kidneys, to your eyes, to your sexual function. It will cause a lot of damage. So it is really important that you get ahead of it. First thing you need to do is get it checked, find out, get diagnosed. And if you have it, you must treat it. Do not ignore it. And if that means you want to take medications, that's okay. And then if you're taking those medications, make sure you go get it monitored. Make sure that you're hitting the right numbers. Be consistent about it. But if you want to get to the root cause, you're going to want to start with whole foods diet, nutrition, get rid of the processed foods, start to move, whatever movement looks like for you. Manage your sleep apnea, take omega-3, take magnesium, take vitamin D, and get ahead of it.